Hi guys, welcome to Health and Science. I'm here with my dear friend, Dr. Hakimi. He's located in Beverly Hills. Hi doctor, how are you today?
Hello, good morning. Doing great. It is really a foggy morning here. I'm sure you guys are a few hours ahead.
Yes, only two.
Sure.
Doctor, can you tell
Yes.
us a little bit about yourself?
My name is Michael Hakimi. I'm a plastic surgeon here in Beverly Hills. I finished my training in 2016, so I've been in practice for about going into 7 years. My practice is about 60%, 65% liposuction, 35 to 40% face. I do a lot of lipo. And out of that, about half of my liposuction, I do them under local anesthesia. The other half, for people that want total body liposuction or those who don't want to be awake during the surgery, we do them under general anesthesia. I started doing this because I realized a lot of people go get cool sculpting. They get alternative treatments that are not quite as good, far from it, mainly because they're afraid of general anesthesia, or they don't want to have prolonged recovery after the surgery. So that was my initial motivation to pursue this and kind of perfect it as much as I can. The patients that are good candidates are patients that don't have much anxiety, patients that are hesitant to have general anesthesia, patients that don't want to have all of their body liposuction, because when we do local anesthesia, and I can explain to you how it's done, we usually give them it's oral sedation, right? So Xanax, Valium, Norco, some sort of pain medication to make them relax and happy. These people are not unconscious. They're still conscious. They know that they're getting surgery done, but they're very tired, sleepy, and relaxed, meaning if I don't talk to them, they're going to start snoring on the table, and it happens every day. If I ask them, hey, can you move your shoulder? Can you turn over? Then they're alert enough that they would turn. Then during the surgery, we very gently numb these patients. The surgery takes slightly longer because I have to very, very slowly numb them up. So you feel the initial injection. If you've ever had Botox injection, it's nothing more than a Botox injection when the surface of the skin gets numb. Then through those numb areas, we're going to go under the skin and put lidocaine into the fat. After that's done, then the actual surgery is pretty painless. You feel nothing. And these patients have a shorter recovery in the sense that there's no intubation. You don't have that post-anesthesia foggy brain. You don't have the sore throat associated with general anesthesia and intubation. Also, I do a lot of heavier patients, BMIs over 30, 33, that when you see these patients, you always have to talk about the risk of anesthesia and higher BMIs, as you very well know. When we put the body under general anesthesia, your blood pressure drops. As the blood pressure drops, the blood flow into the deep veins in your pelvis, in your legs, also gets slower. As the blood flow gets slower, your risk of forming blood clot in your vessels also goes up. That's why they say, that you shouldn't put individuals over a certain BMI under general anesthesia for long surgeries, because that risk of blood clot formation goes up. God forbid if that gets pumped into lung and heart, it can be a devastating complication. When you do this under local, Dora, there's no risk of, I would say never, but it's very, very minimal, close to zero, to form blood clots in your veins, because you're not going under general anesthesia. We're not dropping your blood pressure, and on occasions we're going to have you move around. So all of those together are the reasons that I try to push this local anesthesia liposuction for patients. Now back to the original question you asked: who is and who's not a good candidate for this surgery? People that want to have total body liposuction, they're not good candidates for this procedure because in order for me to numb you up, there's only so much lidocaine I can give you to numb specific areas, and that's based on your weight. It's usually enough to do a lipo 360, even for a BBL at the same time, or fat transfer to breast. But if you want your arms, your thighs, your abdomen, your back, and then fat placed in your buttocks, the amount of lidocaine that you're going to need for me to be able to numb you up is way over the safety limit. Now, not to say we can't stage these. I've done this many times, that you come in one day, we do liposuction of a certain areas, then we come back in 2 days or next week and we liposuction the other areas. As long as you are not within 24 hours of each procedure, you can stage these. People that have, they're scared of needles. I used to say this, but now more and more I do it on them. And I think with enough reassurance, talking, and the medication that they're on, I've done it on a lot of patients that they're afraid of needles. They don't even go to a dentist office. In the beginning, they're a little on the anxious side. They can't fall asleep. They're just alert, hyper alert to see what's going on. But as the surgery proceeds and you get through the numbing portion, they're pretty relaxed and comfortable.
So basically, you can hear everything. Like, this is amazing to me.
Yeah, you can hear everything. We try to keep the operating room environment very controlled, meaning I tell my nurses, when you open the cabinets, don't close them quickly. You don't want patient to jump, because everything has to be very very quiet. We play music. I usually ask the patient what they want to listen to. They can hear me, but as I said, 9 out of 10 after an hour they're going to be like they fall asleep.
One of my patients was sharing some of the surgery, and she told me, yeah, they play the music. I wonder, it was very relaxing. And then she started seeing so many flowers inside of the surgical room. I was like, flowers? She's like, yeah, it was like so beautiful flowers. I never seen this before. I was like, yeah, now I understand what happened. Can you share with us? Yes.
I think it was the medication there. So the experience varies depending on what medication the doctor uses and how patients respond. I would say the most common thing, besides being sleepy and relaxed, is in their relaxed mode, they ask me questions, right? Because some of them, they want to see the surgery. Some of them, they don't. So we have a curtain that we put over their neck. So those who don't want to see, they can still talk to me, or they can take a nap. Or those that are really curious to see how it's done, they actually, they lift even their neck. They try to see how the procedure is done. Some people, they ask questions, but you don't remember the answer. So throughout the surgery, they can ask the same question 4, 5, 6 times, and they forgot that they asked this question 5, 10 minutes ago, and I gave them the answers. Some, they act very normal, but tomorrow when I call to check on them, they say yesterday was a blur. I don't remember anything from yesterday. On occasions, people start to share very deep thoughts. Like, I really think they get very comfortable because they're on medication, and they talk about their life and their plans for the future or the recent past. But I always tell them what happens in the OR stays in the OR. So nobody remembers anything when the procedure is done.
Oh, wow. That was my next question. I was about to ask you, is there any secret that somebody shared with you during surgery?
No, there are secrets. No, we chat a lot. I joke that my surgeries are half local, half vocal. During the case, I talk to them about how I do the surgery. Every step I explain to them, because I truly feel like when people know what I'm about to do, there is less anticipation, there's less anxiety associated with it. So let's say if I do 3 surgeries a day, I go through every step 3 times. No, it's more like I talk about travel trips. I talk about my travel trips. I learn a lot about my patients, and they learn a lot about me. I don't know how much of my things they remember, but I feel like every patient, I get to know them on a much deeper level than I would have if the surgeons were under general anesthesia. When you go to sleep and you wake up, everything is done. You feel like it was magic, but they have more. They participate a lot more when it's under local.
That's kind of like very, very interesting to me.
It could be good or bad. It's not for everyone. And I always tell people, it's not like that's all I do is local anesthesia. As you very well know, when somebody comes for lipo 360, or they're like, listen, I like your results, but I don't want to be awake. Absolutely. I have a doctor who's my anesthesiologist, and he does all my cases when I have general cases. I do tummy tucks, facelift, etc. Those are always under general anesthesia. The local thing is something I offer for people to save them from going under cool sculpting and getting disappointed.
It's not the same. It will never be the same.
Will never be the same. And, almost every day I do a patient who's had rounds and rounds of cool sculpting. And for all of your clients, sorry, go ahead.
No, go ahead. I have a list of questions for you. Go ahead.
Okay, let's see. I hope this is one of them, because I really want people to know, you go to these non-invasive procedures, whether it's cool sculpting, sculpture, all of these, freezing the fat, melting the fat, etc., and they feel like it's a free pass and you have nothing to lose, but you do. The quality of your liposuction is never the same when you've had rounds and rounds of cool sculpting before you realize that the result that you want is going to take many, many sessions and may not be achievable with cool sculpting. Every time you freeze the fat or you use any of those laser machines, there's a lot of inflammation and scarring underneath your skin. So what you feel it, you're like, oh no, everything moves, everything is soft. But the moment we go in and we put the numbing medication, everything becomes hard like concrete. These individuals, it's more work for your surgeon. And also, you may not be able to take all the fat out just because of the amount of scarring that you have in there. I used to say that this was an exception, but these days, almost every other day, I do a patient who's had rounds. And last week, I did someone who's had 6 rounds of cool sculpting before she came. And we still took about, 4.5 liters out of her. But
like this much.
Yeah, that's true. That's a 5 liter fat. Now go ahead with your questions. Yeah, I'm ready.
Okay. Let's see. What is the main surgery that you specialize in?
People love asking that question. It's just, when you do plastic surgery and you do aesthetics, there are only a few surgeries in this field. I don't do rhinoplasty because my patients, by the time they get to me from the moment I started my practice after training, they'd had their noses done many, many years ago. So if it's not something that I do every day or every week, and if there is somebody else next door that could do a better job, I don't think I should be doing it. And I always refer out my rhinoplasty consults to people that I know that's all they do. They do rhinoplasty at least once a week. My practice, as I said, is about 40% facelift, 60% lipo and fat transfer, whether it's under local or general. So you could say those are the 2 things that I specialize in, because those are the 2 things that I do the most of. I still do breast augmentation, tummy tuck. Patients come to me asking for them, by all means. I wouldn't say I do it more than average Beverly Hills plastic surgeon, but definitely facelift and liposuction.
Is there a reason why you like this procedure more?
Yeah. I don't like putting scars on people. Okay, even though the scars heal well, and when I do a breast lift, I know that the amount of improvement that one gets from the form is worth the scar that they get on their breast. But with liposuction, you can really, really hide the tiny little incisions. You can really hide your work. Once a friend said, when you watch a painting, you don't want to see the paintbrush. You want to admire the art, not to be overly, romantic about my job. But if I can do something that I can hide the scar and people could go enjoy their lives without having to explain a scar, it's very gratifying. I think for facelift, even though we do make scars around the ear, but the scars are so very well hidden and they're so soft and thin. It's very, very it's very gratifying to me, and liposuction equally. We do a full lipo 360 with an incision between the buttocks crease that usually nobody sees, 2 incisions in the pubic area that nobody usually sees, and 1 in the belly button. Not to mention the results are very dramatic, as you know. I mean, these people, thanks to social media now, I can follow them, they follow me, and I see like in a week or two, their self-confidence, the way they post, the way they talk about their bodies, the clothing that they wear. It's altogether, it's a very gratifying procedure, both lipo and facelift.
I like that you talk about that. The confidence, like that's the reason I got into this job, right? That's my motive, right? I love to help people feel good about themselves, look better, be more confident. Like that's so beautiful.
I feel like as surgeons, we don't spend enough time educating patients on the importance of post-op care. And I also feel like patients, as they go through this process, even my best patients, they've done a lot of research, first finding the surgeon, doing research, interviewing a few, picking one. They're not, until the surgery is done, their focus is somewhere else. They just want to get the surgery done. And I always feel like we need to re-educate them right after the surgery one more time, because I'm surprised how much of the stuff that we tell them before the surgery, maybe it's just too much information for them, but then they forget the moment the surgery is over. So I always bring them 1 week after the surgery to go over everything, no lifting more than 6 pounds. It's funny because I tell them no lifting more than 6 pounds, no pulling, pushing, for example, for breast lift, which has more scars than the breast augmentation. I had this patient that showed up 2 weeks after the surgery, and she said, "Doctor, I know you said no lifting, but every morning I would wake up and do a yawn, and I would bring my arms up, and I think I heard a couple of clicks in my vision line. Do you think that could have been a stitch?" I mean, you try to control as much as you can, but at some point, there are things that it's good to ask your doctor before you feel like he didn't say don't yawn and pull stuff. But yeah, and as far as liposuction goes, you and I are both in this business. It's huge. The post-op recovery. That's how we met. For those of you who don't know, we met in Colombia in a recent trip that I had, and the importance of post-op lymphatic massage, post-op diet control, and weight control after liposuction is probably more important than many other things that we do. So here I work with a few lymphatic masseuses in my area that I've seen their work, and I know they're well trained and they have good protocols. But once in a while, at least once a month, when I have a patient that comes back for a follow-up and I see that the post-op recovery is not quite as smooth as it always is, when you question them, you realize that the person that they picked for lymphatic massage is someone that's more of a masseuse, and they don't have formal training to do post-op lymphatic massage. And I just want to make sure people know that post-op massage is a whole different technique, whole different caliber compared to deep tissue massage or other massages that you get when you're not post-op.
As you know, every patient is different, and every patient is healed different, and it also, the protocol changes according to the technology that you as a surgeon used inside of the surgical room. So we use non-invasive technology to improve what you started in the surgical room. So a patient just come to Belleza Colombiana. We take before and after pictures, very similar to what you guys do. And we either ask for a referral from their surgeon, or we already work with the surgeons, so we already know what this patient got done. For example, if you got done any body tight and any that had produce heat, we avoid to use heat in the first couple of weeks. So
on that note, sorry, I'm going to interrupt you. Yes, you don't use heat, but do you start your massage immediately after the surgery, even if there is body tight or Renuvian involved?
Yes.
Or would you start them a few days later?
We prefer to start 24 hours after surgery. each surgery. Like, it doesn't matter when they got done, they should start 24 hours after surgery. So we have highly trained staff, and we avoid the swelling to go up. We just try to keep it at the minimum and start going down like within the first 2 weeks. My post-op is very, I would like to say, intense, because I want them to feel better as soon as possible. So don't forget, I'm from Colombia, from Medellin, Colombia, the capital of the plastic surgeries. And a lot of people just fly in and they stay 10 to 15 days in, and they have to fly back. So we had to do it like as quick as possible. And then when they go back to their cities, where they belong to, they start doing another set of treatments. So what I did, I got all the knowledge from plastic surgeons from Colombia and Brazil, put it together, and just got my own protocol. I cannot speak even like more about like the benefits of the collagen bed. This collagen bed, they just lay down and for 30 minutes, but it does magic. It actually does. It works on cellular levels, so they start to restore like cellulars, and they just heal faster. So they lay down for...
Explain what it is. What is this?
Collagen
bath?
Bed. So it looks very similar to a tanning bed, and it has red light. It goes to very, very deep. This light goes very deep into your skin, even to your organs and bones. It don't produce heat, so it is no infrared. It's just red light.
It's LED red light. Okay.
Correct. So basically, that's the only time where they're actually sleeping. They lay down. It's very comfortable. It don't produce heat, so it's really, really comfortable. And we have pillows and all type of gadgets, so they actually rest. They are able to rest. So if they had a tummy tuck, we elevate their legs. There is another thing that patients don't think about, how they're going to sleep after a surgery, right? So we have all type of things so we don't damage either BBLs or tummy tucks. And it's very relaxing. It helps a lot with bruising. Like, the bruising is basically non-existent. And if you check my before and after pictures, and within days, they go back to, their skin looks normal, the health of the skin. That's another thing people don't think about, is the health of the skin after surgery. So it's amazing, and we do lymphatic drainage, but it's not our priority. We use technology to break down the fluids first, and then we flush it out. So our treatments last around 2 hours, and they go to the restroom at least 3 or 4 times in those 2 hours. So when you are in here, because we have 15 rooms, you see constantly people just walking, going to the restroom, and which is also good because customers go home and they don't walk. They don't want to move. They are in pain. And sometimes they don't understand how important it is for them to start moving. Not working out, but at least walk. 5 minutes. Keep your body, the circulation flow good. So when they get a tummy tuck and then they go to places where they don't have money to buy professional equipment and they only have these things, oh my goodness. I have seen horror
Explain
stories.
to our patients what those are.
So this is called wood therapy. When I went to school 20 years ago, I had to take this class. And my teacher told me, in order for you to pass, to graduate, you need to learn. You need to learn this. But promise me you will never do it to nobody. So a lot of people use these rollers. There is all kind. And they use it as a post-op tool / I don't know. I don't really understand why they want to have trauma after the trauma of a surgery, right? So Let me show you this. So this is our skin, and we just got a lipo, right? So all the fat that we had, it was in between this and this. So some people use it for swelling, and some people use it for fibrosis. So what happened is they just go do this to your skin. And this one is actually soft, because I have seen one that has like sticks and
Spikes.
right, spikes like that. So what happened is, you know what happened, right? You just got Renuvion or Baser. Can you tell me what happened if I start stretching the skin after a surgery?
So it's a very loaded question, but what you have very good points with this, right? People don't realize that when you liposuction, there is some level of trauma to your skin. Most of them are deeper, but if you do high def lipo, meaning etching of your abs or your arms, etc., you basically almost are damaging the very tiny vessels that are under the skin, which is fine. It heals in a healthy individual, non-smokers, not on medication, etc. But when you go home and then you put more trauma on top of this skin, then you can have healing problems. You can have scarring. You can have fibrosis. There are people that they've had radio frequency done, and then they call me by somebody else. They're like, I think the doctor burned me. And when I look at them, it's not that they're burned. It's the fact that the skin over the bony prominence, usually under the rib cage, around the hip area, when you do a lot of radio frequency, you burn all the blood vessels that are under the skin. And then these individuals go either sit on them, or they have a very tight garment that's digging in. There is already trauma and very bad blood flow. Now you mechanically are going to compromise that skin. And there's no question that skin is going to, if not completely die, is going to look like it's a burn patient, because it blisters sometimes it has hyperpigmentation, and sometimes it has fibrosis. Now, as far as stretching it goes, from a clinical standpoint, when you undermine the skin, whether it's tummy tuck or liposuction, you don't want to put tape on it, and you don't want to stretch it, because it causes what we call epidermolysis, which is basically blistering on the skin, which means the very top layer of the skin, you can lose it. Now you're going to grow it back again, but that exposes you to hyperpigmentation and other complications.
That subject is very, very important. So let's finish with this one. I hate wood therapy. I don't do it, and I feel people that actually cannot afford technology, they just lie to customers and tell them, oh yeah, this wood is gonna work. It's like, we want to race F1 race with a Camry. It doesn't work like that. You need technology.
Okay, question for you. Let's pause here before you move on. Would you ever use this on a non-post-op patient?
No.
Okay, so done with wood therapy. You don't like it, you feel like it damages more, it doesn't accomplish much. Done with wood therapy.
Yes, so basically, a lot of people use it for cellulite, and damage more than what it actually helps. This gives you those little veins. So probably, yeah, your lymphatic system is gonna work better according to the book. That's what the book says, right? It's good for your lymphatic system. But also because it's so much trauma to the skin, you get a lot of bruises, and when the bruises go away, you can see the little veins. Also, because of the spikes, they are stretching out the skin, and I have seen it many times. They come to me because I also do body contour, but I have technology for that. So they come to me, they want me to fix something that is already unfixable. The skin is too loose, and it's so much also. Even with patients, post-op patients, they come and they have like a loose t-shirt on. That's how their skin looks like. And they're like, yeah, I got done Renuvion, and I was so nice. And then this girl came to my house, did my massages, and she did also wood therapy. I'm like, how? Wasn't it painful? Like, after surgery, you cannot even feel like nothing, like even the fat is uncomfortable sometimes. And how did you manage to get wood therapy done after surgery? Oh, no, it was very painful. I passed out and everything, but she said I needed it. Wow. You know, those are stories that you hear. So sometimes they want me with my machines, with my technology, to help the skin just retract. I'm like, no, you go back to your surgeon, get a second surgery, or third surgery, I don't know, and see if they can actually fix it. Now it's too late for me. I mean, if you come right after surgery, I improve whatever technology they use in up to 30%. So their skin get like tighter, and I show you, we have a 5 weeks protocol and a 6 weeks protocol. My goal is by the third week, they're actually like 80% recover. Mm-hmm. So sometimes there are surgeons that don't see the importance of getting post-op treatments, and they say, no, your body's going to get rid of the fluids. And yes, the body's going to heal itself, but how long is it going to take? That was one of the questions. If I don't do post-op treatments, how long is the swelling going to be?
So I tell my patients, majority of your swelling is going to be gone within the first month, okay? First month, 6 weeks, you're going to be able to look in the mirror and see the result. But the result is not final. It's going to get better and better for up to 3 months, sometimes longer. Those who get on it, they do treatments every day, starting day one after the surgery. I really think at 2 weeks, they look like the old 1 month treatment. And at 1 month, they look almost close to the 3 months. So I even lowered the number of days I want them to wear compression garment. If they're really compliant with their lymphatic massage, they do, let's say, 10 sessions every day after the surgery. I only require them to wear the compression garment for about a month after the surgery. And then the second month, they can just wear it at home. So I would say at least minimum 2 weeks faster recovery. So think of it, at 2 weeks, you're going to look like you would have looked like at 1 month after the surgery. But that's just because we're trying to quantify this. Otherwise, the amount of fluid bruising that you get out of the body the first 2 days after the surgery, it's logarithmically better than waiting for your body to get rid of them. The first 2 days are so crucial in removing the bruising, removing the fluid out of your body, getting your discomfort out on control. Usually these patients that get the first 2 sessions right away, they have close to zero bruising. Their swelling is so much less to begin with. And majority of them, they say, oh my God, I got off the table and I felt like a new person because I could move. It's because it releases all the adhesion, scar tissue. And as you know, Dora, all the inflammation sets in within the first 4 days. So I tell my patients it's crucial. If you can't go tomorrow, at least the next day, don't let the first session be longer than 4 days after the surgery. Sometimes the incision can close. Sometimes the swelling gets sucked into the sponge-like tissue and it's harder to get it out.
That's very important, what you just mentioned, because the more that they wait, the deeper the inflammation fluid goes into the tissue, which is harder to get out.
Sure.
So sometimes they are like, no, I just want to wait 2 or 3 weeks and then I'm going to feel better.
Right.
The longer that they wait at home, the complicated it is for us to help them, because the fluids are going deeper and deeper, and sometimes the skin gets hard or they already get loose skin again. I have many cases where they waited 6 weeks, because that's what many surgeons here in Texas say, wait 6 weeks. Oh my goodness, 6 weeks? By the 6th week, you should be fine, completely fine after surgery. So have you got any complications with patients that they didn't want to get touched?
So listen, up until a few years ago, we still could get good results without lymphatic massage, right? It's not that, I don't want to say the complications are because they didn't get lymphatic massage. But as surgeons, we're able to do much more aggressive work because now we have the lymphatic massage post-op, right? Occasionally when they come in and they're hypersensitive after the surgery, like on their 2 weeks follow-up, when I see them and when I touch and I feel like they're slightly uncomfortable, it tells me that they haven't had massage. They're not even touching their skin. They're so afraid. So your nerve endings stay very sensitive after the surgery. That's probably the number one thing that I see. Sometimes after the surgery, you have these, they're not many, but you have occasional lumps under your skin that feels like a hard nodule. This is normal. Sometimes the heat or liposuction, there's a little bit of dead fat that kind of scars down in a corner, and you have to massage it and work it out. If you start your lymphatic massage right away, those don't form, or if they do, they're going to be soft and your masseuse is going to get rid of them for you. If you don't get it and these form, then we have to wait weeks, if not sometimes a couple of months, for those hard nodules to go away. I don't do Vaser in my practice, so I haven't seen any fibrosis, but that's probably the number one complication that people say. Those who don't get massages and they get very aggressive high def with Vaser, they're much more prone to getting fibrosis also.
Yes, like any type of technology that produce heat, I noticed that yes, they get more complications. And what you mentioned before is about the nerves getting the wrong information. Some people don't feel anything, don't feel the skin, but there's people that actually feel way more than what they are used to. So they don't like to feel the touch, nobody, not even their clothes, they can feel it, right? So we have machines, we have equipment for that, which just, how can I make this sound beautiful? It's energy. Some people get scared, like, oh, I don't want energy. This hurts, or this is uncomfortable. But it actually helps restore the nerves faster. In many cases, we had patients that they lost all sensation after a tummy tuck for many, many years, and we were able to help them activate all these nerves and sensors. It's really beautiful to see somebody that actually had, they got a nice shape, but then they don't feel anything. So they did regret the whole surgery. But the problem is not the surgery. The problem is they don't take the right post-op protocol.
Yeah, absolutely.
So one of the questions, are the LA customers different than any other city?
No. Having talked to you from Texas, having talked to many from either other countries, I think the body contouring patients, for the most part, it's not where you're from. It's your expectations. Like my Hispanic patients have a different expectations from, other ethnicities. So I think how you want your body to look like at the end is a very personal choice. It's not where you live. It's where what your aesthetic ideals are. And I don't think LA is different from, Brazil as much, or in Texas, because honestly, with social media in general, the aesthetic ideals are almost universal now.
True. So how do you deal with patients that want unrealistic results?
Oh, I'm very easy. I just don't do them. The moment that I feel that I can't, I say no a lot, Dora. I say no to 50% of my consults. If I don't feel like that's the result that I want to have my name on, or if I feel like the patient is pushing the limits and they don't know the risk, you can't convince me that it's okay with you to have a complication. I saw a patient last week. She was on her third BBL trial, and this woman had no more fat left, and there was a huge discrepancy between hip to waist ratio. And I'm sure she's going to find someone who would do the surgery. But the way I don't deal with them, I just tell them the truth. I educate them why it's not a good idea, and I tell them why I'm not a good surgeon. I'm not the surgeon for them. the surgeons pick and choose what level of risk they want to take for their patients and what type of results they want to have their name on. Now, I feel like every patient is it represents me and my aesthetic. So I think that's why I always tell them, go see other surgeons also, even those that I want to work on. You learn a little bit from each of them. It's like speed dating. And then you have to like the surgeon has to like you for this to be a successful journey.
I love your honesty. I really do. Because
we try.
No, it's very important. I don't want to go under anesthesia and wake up and see that I didn't get what I want, right? So it's very important, as I do the same. If they come here and they have a certain amount of extra pounds and they want to look like they just got a lipo, I'm like, okay, you're going to need maybe 50 treatments or 80 treatments. I'm not going to promise you something I cannot give you. Or some people that they actually did a lot of dieting or took pills to, for like weight loss pills, and now their skin is completely loose. I have to tell them, no, you need a surgery. I cannot help you. I have to.
Yeah. That's our job to educate.
I'm sorry?
That's our job to educate them.
Right. Doctor, thank you for your time. Thank you for educating us. This is very, very important for all of us. And I hope to see you soon.
Thank you, Dora, for having me. I really think these are important. I plan to incorporate this more in my patient education and my follow-ups. And I would like to invite you on my platform sometime to talk to my patients. And I appreciate what you're doing for yours.
Thank you, Doctor. I'll be more than happy to be in yours.